over $167 billion. Now, we will have disagreements on policy on so many other things. I can tell you that, having, growing up in, being from Uttar Pradesh, growing up in Jammu Kashmir and going to medical school in Delhi, it has been a privilege not only to serve in the White House, answer to the President of the United States, but also been able to make a significant contribution as the first physician and the first immigrant to hold this position. It's been important to demonstrate and highlight the role that immigrants like myself play in furthering the country, saving more lives, and making sure that we're leaving the office as well as the White House better than we found it. It has been an absolute honor and a privilege to work here. I have had the pleasure of working with a wonderful team of experts and professionals who put in time day in and day out. But I will say that at the end, I leave with what's most important, which is saving lives across America. And with that historic record that has been accomplished, it's something that we have way more work to do still, because the burden of those people who are still dying weighs on me heavily. So I wish the incoming team all the best, and I'll be there to support them in any way possible. President Biden asked me to look at really the fact that in 2021, when he took office, we were seeing 31% increases in overdose deaths year after year. So he really asked me to take charge of it and see how we can, as quickly as possible, bring those down. I knew we were dealing with over 100,000 Americans dying a year from drug overdose and tens of millions of more suffering from it, including so many more non-fatal overdoses. And this is a fact that we know now affects countries all across the world. So we took this approach, and I produced the President's strategy back in 2022. And we took an approach where we will, like a large ship, you have to slow it down, then you have to turn it around, and you have to move it again. So over that course of time, we've implemented and put money behind specific policies designed to save lives and get Americans more into work, basically, into treatment and back into work. So what we have today is not only a 17% decline in overall overdose deaths as of the mid of 2024 data, but a 22% decline in fentanyl overdose deaths. So if you think about it, that's over 50% turnaround in just a matter of few years. Why that's happened is we focus on putting over $167 billion into United States communities, states, and others. We made sure that the antidote, like naloxone, was available far and wide to anyone who wants it, and more affordable. We went back down from $100 to kit price, a kit for 2 doses, to $24 now. So significant improvements. We made telehealth and technology more available to people to get treatment anytime they want. We made prevention an important role in stopping drugs to start before they even begin. We also have then made sure that employers like Google and others have become recovery-friendly employers. So that means that they're hiring people who are in recovery successfully after treatment, because a job fixes a lot of problems as well, and that finds a purpose in life. So while we did that, we also partnered very closely with global nations. We declared this as a global threat. I very specifically have said that there are 3 kinds of countries in the entire world. One, that have a drug problem like United States and know about it. India is also in that category. Second category is countries who have a drug problem but yet do not know about it, and it's our job to make sure that they are aware. The third is countries that are going to have drug problem, and we want to stop that. So with that mindset, we worked with the State Department to develop a global coalition where the countries like India and others have been very good partners to us. And we made sure that everybody was aware of this, and they were doing everything across the world to stop this from happening. So we have worked with countries like India to create and celebrate some of the most forward-leaning drug policy framework ever established between our 2 countries. President Biden and Prime Minister Modi celebrated that agreement in September of 2024, which was signed by myself and Ambassador Quattro. Yes, that cooperation is in three pillars. The first pillar is counter narcotics cooperation, which is law enforcement and other activities to joint share intelligence and activities and operations to stop coming from into the shores of India, also finding out where they're coming. Second is public health, to ensure that the extraordinary advances that are being made in both countries are supported and shared with each other. So we have more engagement of academia to academia, treatment providers to treatment providers, workforce. For example, the United States has a very shortage of public health workforce in terms of psychiatrists, medical doctors, nurses, counselors, and others. The third pillar is developing a supply chain for pharmaceutical productions of the future to make sure that there is a competent way of having the needs of in the United States of pharmaceutical supplies, but in a way that has integrity in it. And it's a complete cycle, the whole supply chain. And we're looking at also advancing technology. What's the role of technology in drug discovery, artificial intelligence and machine learning into drug discovery? So going at the 21st century challenges together as two countries, two democracies that lead the world in so many other things, also advancing technology and drug discovery at the same time, while having with integrity a global supply chain. When we look at just last few years, the impact of COVID or coronavirus, we've seen the importance of global leaders stepping up when it comes to especially cooperation in public health, healthcare, technology, and science. That's why some of one of the two biggest leaders in this area is United States and India. So it's very important that we look at where we can cooperate and find those areas. So for instance, using artificial intelligence to conduct drug discovery. Not only will it save time, make it new products much more cheaper, but we'll have more access to the global world, the entire population of the world at one point. And this is an important part, both for the United States and for India. India has been able to distribute its vaccine across so many countries when it came to COVID. It's going to be important that we follow that model when it comes to medications like not only addiction, but high blood pressure, diabetes, and so many others. Similarly, we look at public health aspects, whether it's workforce, whether it's training and education, or it's the necessity of having vaccines and other elements that help keep our two populations safe and healthy, as well as having a friendly environment to do it. I think India has advanced quite significantly in the recent years. When I travel to New Delhi, for example, I see the large billboards that talk about the importance of addressing addiction. It used to be myself, my mother back in the 1970s spoke on All India Radio about the terrible consequences of alcoholism. Mm-hmm. And today, this is the synthetic drugs. It used to be where you had ganja, charas, and some of the heroin. But today, the new Pandora's box is open where you can use, your closet and a little bit of chemicals that you can get, and online find ways to create some of the most dangerous drugs at home. So it becomes important that the parents, the teachers, the neighbors, and everybody in the community understands that and works against that within that community. Therefore, India, with a population of over 1.4 billion people, the risk is there. But the will to prevent drug addiction or drug use from the beginning is also there. I've seen it. The current government is doing a lot of effort. I've met with a number of the ministers there, as well as the Prime Minister Modi. And there's a lot of work that is happening. I think what we have seen and learned in the United States, the number one cause of death in people working age between 25 and 49 is drug use. So if you think about that, the large population that is working age, India has 600 million people with the average age perhaps about 27. It's going to be very important that they are looking at this work performance, academia, work opportunities and education and other things. This is one that we must fight against to prevent it from the first step. And secondly, if somebody has trouble, then we have to make sure they get treatment. The stigma of drug use and stigma that related to people who get into the throes of addiction is very important to fight against. And everyone in India, just like the United States, has to work towards it. So I have two children. I make sure that I'm always talking to them and engaging them in conversations so they know the dangers of drug use. All the parents, all the loved ones and families across the world need to be doing that with their children and for their children. The partnership and the allied work of United States and India has crossed the point of no return. I think it's important for the world, the safety and security and health of the world, that these two nations, two great nations, maintain and accelerate their partnership, their cooperation in all areas. Because when we have a United States and an India that are looking forward together to solve the world's problems, it is the only way we're going to be able to solve the world's problem, because this is really where East meets the West. And I can tell you, having grown literally almost half and half in both places, that there's significant differences between the philosophy, the culture, the thought, the thinking, and the history of the East and of the West. And this relationship allows the two countries, but also the continents of the world, to come closer together, to understand each other, and at the end of the world, to solve the most pressing world's problems together as one unit, so we can inspire the next generation of countries coming up to work democratically in a way that will help this planet. Well, let me start by first saying that every administration will find itself appointing an increasing number of Indian Americans. And it's not because they're Indian Americans, it's also because they're some of the most competent, hardest working, most educated people that you see on the planet, not only in the United States. The industriousness of the Indian American people is very much a proof of the success that they see. So what you see as, it's 1% of the population of this country, but pay 6% of the taxes. You see as a level of crime, you'll see as a high level of academic achievement, professional achievement in all areas. I think it's a model population, and it needs to maintain that model population status. It's very important. As Indian Americans, we bring a sense of culture, a sense of wanting to do excellence and making sure that we make this country great. And it's important that the Indian Americans find this number of people that have been working in the last 4 years, an increasing number in the years to come, as a mark of excellence and dedication, but also feel that they can also do that. And there's nothing that stops in the land of opportunity from achieving this milestone for any population of this country. And that's the gratefulness thing about this country. It could be Indian Americans, it could be Chinese Americans, it could be Hispanic, it could be African Americans. So all of our subpopulations in this country, this is an opportunity to achieve greatness, to achieve so much more for themselves and their community. This is what this land of opportunity is.